folks. Welcome to the webinar where tonight we are actually doing part 2 of our Iridology series. Iridology? I think it's Iridology. If you didn't see the first webinar on this topic, I recommend checking it out where the focus was on the gut health connection to iridology. And tonight we're shifting the focus into one of the most important systems that iridologists observe, being immunity, right? The immune system. And because the eyes not only provide information about those metabolic shifts, but they can actually reflect inflammatory burden, microbial imbalance, immune activation, and stress overload as well, and all before symptoms even start to appear. So if you're completely unfamiliar with the topic, the eyes are directly connected to the nervous system. And the nervous system, it collects all manner of information about what's going on in your body. And the story of this information can be told by analyzing your eyes. And when it comes to the immune system, I mean, changes often show up around the iris earlier than anywhere else. So, I mean, this is a great tool for identifying immune system dysregulation. And when combined with our genetic insights, we land with a really robust toolkit for helping to keep people healthy. And that's what we're here for. And here to make her triumphant return to the webinar to enlighten us all on this topic is the great and powerful Jessica Halpern. Welcome.
Thank you. Nice to be here. Thank you for having me again. So for those who were not here before, my name is Jessica. I'm a board certified integrative medical iridologist. I'm also a certified functional genomics practitioner, as well as an integrative nutrition health coach. So yeah, I'm excited to be here to talk about all things iridology and genetics.
Okay, so it is iridology, not iridology.
Yeah, iridology, like iris.
Right. Okay. I will be referring to it as that for the duration of the webinar. So before I unleash Jessica on the audience tonight, because she's going to go over some great case studies and things, I'll have our angels in the background pull up the poll if you wouldn't mind, and we can go over it to see what people are looking for tonight. Thank you. Thank you. Okay. So we asked you guys a handful of questions here to kind of get a gauge on the audience. And the first question that we asked is, have you ever noticed changes in your eyes, right? Like redness, cloudiness, color change when you're ill, so during illness. And actually 50% of you said, yeah, you have witnessed those changes. So that's really interesting. 20% said no, and 30% said unsure, just probably not looking at that particular area to notice any changes. Jessica, is that a common thing? Do people, like, do your eyes change when you're actually sick or no?
Well, yeah. The color doesn't change, but it may be a little more dull, or the whites of your eyes may get a little reddish or pink or, cloudy.
All right. So they can, in fact, change when you are sick. That's good to know.
Yeah.
The second question that we asked is, when you think about immunity, like, what do you feel impacts it the most? And we listed, stress, gut health, sleep, nutrition, genetics, and almost all of you, like 52% of you actually said gut health, and 26% said stress, 9% said sleep, another 9% said nutrition, and then 3% said genetics. And what I think is interesting there is that everything that we listed kind of lands in that epigenetic bucket, right? Like stress and sleep and nutrition, all of those things are the inputs that we provide to our body, and they all have impact on immunity. So each one of these things has different genetics associated with it. And then as we control our epigenetics, we can absolutely impact the outcome with all of that. So all of the above, I would say, have a certain level of connection there with the immune system. The third question that we asked is, do you believe the eyes can reflect early signs of systemic inflammation? And 74%, almost all of you said yes. So fantastic. I love where you guys are at. And that's what we're going to be talking about tonight. Just 14% said maybe, 1% said no, and 11% said unsure. So that's exactly what we're going to be talking about tonight. And there's a lot of fascinating nuances within the eye that gives you that information. The fourth question is, what immune issue do you struggle with the most? And relatively even split here with autoimmune tendencies, digestive issues, which are generally linked to autoimmune tendencies, fatigue, which is another thing that's really linked there. And 6% of you have things like recurring colds, and 10% have allergies. Just these annoying issues that are associated with immune system overactivation. And there's a lot of genetic considerations that go into that. The fifth and final question is, what are you most hoping to learn today? And 82% of you said all of the above. So we listed how to support your immune system, how genetics influence immune strength, and what the eyes reveal about immunity. And pretty much all of you are here to recognize all of the above. So welcome to the webinar. If you're new to the webinar, my name is Justin, and I'm a certified functional genomics practitioner. And yeah, I can't wait to dive into this one. And I'm going to go ahead and unleash Jessica on the audience tonight because she is the iridology expert.
Okay, so I guess, Vanny, if we could pull up the eye and we'll go with that. Start with the eye, please. Thank you. Okay, so tonight we're going to talk about this eye. This is a woman of 42 years old who came to me with extreme fatigue, weight gain that she could not get rid of no matter what, constant cold, infections, sore throats, insomnia, all the above. Okay, so let's get started. Okay, let's start with the little orange circle there. So if you see where the little orange circle, I don't have a pointer, so we have these little circles there. So that tells me about her vitamin D. Okay, so when I see something like that, I'm already going to know she has possible suboptimal vitamin D. Well, that was confirmed by blood tests as well as genetic markings in her vitamin D panel. So like the VDR, the VDBPGC, the CYP2R1. So quite a few are suboptimal. So she has an issue that she does not absorb vitamin D well. So then we're going to know already, okay, well, she's not sleeping well. And apparently the vitamin D has something to do with that, as well as, so we were talking about before, she's always cold. Well, if you look at the little blue circle there are two blue circles, but the one on the right side by the yellow oval circle. So that's telling me, we call that a bird beak lacuna. And that's telling me about her thyroid. Okay, so being that she has that and the low vitamin D, and also the over here, the other blue circles, the thyroid as well. And the orange coloring there has to do with her pancreas. So the thyroid is going to make her feel more cold. So we have the UCP1 gene, the uncoupling protein 1, that hers was suboptimal. So because hers is suboptimal, that's leading to poor thermogenesis, which would relate also with the thyroid. Now, if you look, you see a lot of orange coloring in her eye. When I see orange coloring, it also tells me about the pancreas. So back to that little orange circle. That's a vitamin D marker on the pancreas reflexive, sorry. I'm a little nervous again. So anyway, so yeah. So when I see that, that's going to come more into play. Also, how vitamin D can have a more significant effect on her insulin response. And so she already has the poor TCF7L2 gene along with the AMY1. So when I know that, I'm going to know back there again that she's got poor, more susceptibility for diabetes, type 2 diabetes, which will go hand in hand with that pancreatic marking. So, okay, back again. So if we look also, we're going to talk about some immunity. Now, this woman complained about fatigue. So that's also back with her thyroid. But if you look at the two circles of the yellow, you see little like puffs in there. They look like little cloud puffs. We call those tophi. I was told by one woman, I had one patient, he was 4 years old and he was Down syndrome. And when I pointed these out to his mom, she's like, oh, those are what the nurse called sparkles. So I like to call them sparkles just because it sounds much nicer than tophi. Okay, so she's got, if you see all these little like yellowish sparkles all around her eye, we do call them tophi, and it has to do with her lymphatic system. So when the lymphatic system is congested, then we're going to run into some immune issues and poor detoxification. And the fact that these are yellow, so they're telling me that there's more of a toxic burden on there. The yellow color, it's yellowy orange, which has to do with the kidneys as well as the pancreas. So we're also going to look, being that that one particular one there around the area of 15, 15 uh, the 15 minutes after the hour. Okay. So like 12:15, if you want to call it that or whatever, right? So 9 o'clock. Yeah. No, 3 o'clock. Sorry. Okay. Okay. Yeah. So the 3 o'clock, that's going to tell me that's in the lung reflex area. So then it's going to think to me, okay, so she's getting headaches every day at 4 o'clock, and she's an art teacher. So she's around paint all day and all kind of art equipment. And so that's gonna make me think, okay, so possibly she's got an issue with those GST genes because of congested lymph system there and more of a toxic burden. And being that it's in the lung reflex, so it's going to make me think GSTP1 and maybe possibly having a hard time getting rid of chemicals. So when we checked, yes, she had suboptimal GSTP1. So when I found that out, I said, okay, but being that she has a congested lymph system, we're really going to have to make sure those pathways are open so that we don't cause any issues because of that poor detoxification system. So I gave her some minerals and some B vitamins because of some methylation issues, which we can see if you look around the 6 o'clock area. There's a rarefaction there around 6 o'clock. That means that there's more, you can see the fibers, like it's a little darker there. There's a little less density in the fiber structure, but right next to that is a little brown marking. So that tells me that most likely she has poor methylation. And sure enough, she did. So when we have poor methylation, we're also going to have a little more difficulty with detoxification and some inflammation and also headaches. So I gave her some B vitamins and some minerals, which help with the headaches. Eventually, we'll have to do a little bit deeper detox. But first, we have to make sure all those elimination pathways are open. So we need to have her moving her bowels and have those, make sure those kidneys are functioning properly. Because if there's too much burden, the liver putting too much burden on the kidneys, then she may have a little bit of an issue with detoxification. So, and okay, so if we look up top where you see that purple circle, the oval purple, that's up there in the hypothalamus. Now, that hypothalamus plays a big role in a lot of things. Now, when I see that and she's overweight, so right there, it's what we call a radial through that hypothalamus. And up there, so I'm going to think right away the FTO gene. And that's going to tell me because she has insatiable appetite. So when we see there, and then I go look, okay, let's see what's happening with your genes and your FTO. And sure enough, it's suboptimal. So she's going to have a harder time losing weight because she has issues with appetite control. And then again with the thyroid. So it's like a whole system going on with how we can put this together. So her thyroid is weak, and then she's got that suboptimal FTO up there in the hypothalamus, and she's not sleeping. So with the poor vitamin D function and the mark in the hypothalamus, then the vitamin D can also play a role in her poor sleep and insomnia. So we already know we got to work on her vitamin D. We've got to work on that UCP and getting, her thermogenesis up. We're going to work on the thyroid, more important, to see what's going on. And then we're going to look at her DIO2 gene to see maybe the T4 is not converting properly to T3. And if the T4 is not converting to the active T3, then this could be a little of an issue also. But that we need to confirm with blood tests. Okay, and then there's another marker there, like I said before, the other blue there, we have some more rarefaction in that thyroid area. So whereas that bird beak is not in the thyroid area, it still tells me thyroid issue just because of the certain marking. And then when it's confirmed with the UCP gene, as well as some rarefaction going on with the thyroid, and then I find out that her mom has thyroid issues as well as her dad. And so also her mom has rheumatoid arthritis, and she's already getting joint pain. And if you look around the eye, you see all that like white, heavy white, I don't want to say plaquing, but heavy white color, yellowish white. So then we already know, okay, so that's a lot of congestion going on there. And when I see that, I know there's a lot of inflammation going on in the body already. And most likely there's some pain. So yeah, she had joint pain, but also it tells me also possibly emotional pain. So when I do the eyes, I also talk about emotion because behind every physical issue, there's usually an emotion that comes first. So we always have to look at the emotions also because we can't just treat physical without getting to the whole root cause of everything. So every eye tells me a story, and I have to go and see where things are stemming from and where they started, as well as what's going on now. Okay, and then if we look in the center, her pupil's a little on the larger side for being in the light. Okay, so that's already going to tell me that she's more in a sympathetic response. So that's telling me stress. And I don't know if you guys can see, but if you look closely, you'll see some like circles. I don't mean the little puffs, they're like lines that are going around. Can everybody see that? Um, it's like I can point, but you can't see me pointing, right? So they're white lines kind of, and they go around, let's see, like uh, from, let's say the limbus is the outside where you see the darker color. We'll talk about that too, but the darker outer edge, if you go in like halfway from there to what looks like the white of an egg yolk. So if you look at the center, you see the pupils kind of like the yolk, and around there was like a sunny side up egg. So from that edge in the middle there, you see a white lines, and they go all the way around the eye if you look closely. So those are called, what we call them, contraction furrows. And that tells me that those happen, they're kind of like wrinkles in the eye. Once they're there, they stay there. Sometimes people are actually born with that because in today's world, a lot of people come into this world stressed. So, but those happen when the pupil and gets big and gets small, contracts and dilates. So those kind of get stayed stuck, they're kind of like a mark left there. So that tells me that her mind goes and goes and goes. So clearly when she goes at night, when it's time to sleep, the combination of having poor vitamin D, which is related with sleep, as well serotonin and melatonin. So in the morning, we all know that we have serotonin, well, we have serotonin all the time, but when we wake up, we're supposed to get sunlight. So when we have the sunlight later on in the day, we can make melatonin to help us sleep. But if the vitamin D and the serotonin and everything else is not working properly come nighttime, we may not be making the melatonin properly. So that can affect us well. So then we know maybe her mind is going, going, going. And on top of poor vitamin D, then which will relate most likely with poor melatonin, then she's going to have some issue with sleep. So we have a whole piece of this puzzle put together already. And then if we go in the center there, so if it's very difficult to see from far. Maybe I don't know if you guys can all see, but if you look around the pupil, we have what's called a pupil border. And part of her pupil border is what we call a trauma pupil border. So there's like a very thin and missing pieces. So right away, I know, okay, so what happened to your spine? So did you have maybe an accident where you hurt your back? And yes, she did. When she was a kid, she was doing karate and she injured her back very badly, and it's been a problem ever since. But also, when I see that pupil border like that, I'm going to think, okay, she may not be having proper minerals either, because that should be a little thicker and different. So I already am going to know, okay, let's check out what's going with these minerals. But we all know minerals are key for everything. We need minerals for our SOD, for our GPX, for all our genes really to work better. We need proper mineral balance just for the thyroid, for everything really, we need minerals. So if you look at the SLC30A8 gene, that's going to code for the enzyme that will help with zinc metabolism. And when we see zinc, we're also going to most likely think other minerals. So sure enough, this is suboptimal. And that will also relate with the predisposition to diabetes and blood sugar imbalance and a hard time balancing her blood sugars. So then we have a whole picture together here. There's so much more I can talk about, but I don't know, Justin, if you want to talk more about the genes, or if you guys want me to talk more about the eyes, or what, lead me.
Yeah, it's definitely fascinating. And what I'm hearing with this is that when we look at the genes, right, we have a pretty good understanding of like upstream imbalances, right, and things that are going well and things that might not be going so well. And it almost seems like analyzing the eye gives you almost like a robust lab that's kind of confirming things in the downstream. Like I always say, that genes are very upstream, and then labs and markers and things like that represent how it's manifesting. So it's way down in the rapids there. And the eye is like giving you all of this information as well. It's like, oh, you
Yeah.
have suboptimal vitamin D genetics. Well, that's showing up in the eye presentation. Or, the thyroid genetics with the DIO2 and the UCP1, that's showing up in the eye, insulin response, etc. So that's really,
Also,
yeah, it's almost like running kind of really well-rounded lab by having someone who understands what they're talking about look at your eye. And the eye
yes.
is so complicated, right? Like there's even a microbiome to the eye, which I know you guys touched on a bit in the first call. And I'm kind of reminded of a study that was done on the microbiome of the ocular surface and the host's
Oh,
immunity, right? And what it found was interesting. So it looked at how microbes that live naturally on the surface of the eye interact with the local immune system. And it showed that the eye is not sterile, but instead
no.
hosts kind of a low diversity microbiome that helps to regulate immune response. And it's interesting. So the key takeaway there being that the eye, A, has its own microbiome. A lot of people don't know that. And it actively helps to train and regulate the local immune response. So when that balance is healthy, the eye stays calm and resilient. But when it's disrupted, inflammation becomes a lot more likely. And this really matters because if immune and microbial activity influences inflammation at the surface of the eye, it gives us a meaningful lens for understanding iridology patterns, right?
Yeah.
Changes to the iris fibers and rings and color density. A lot of the stuff that Jessica was talking about may reflect that underlying immune stress or shifts in how the body is regulating inflammation, right? So that's a pretty interesting thing. And if we
It,
contrast a little bit here with some of these genes, like how like you were already an iridologist, but then now that you've
Yeah.
also got the functional genomics kind of certification and things going on there, how does that impact your current practice? Like now that you have all this information
Uh,
with
yeah.
underlying genes and enzyme activity.
It's so fascinating. So I started out as an iridologist, and then when I found the genomics, I was so fascinated. And I was like, okay, I want to do research and see if what I see in the eyes correlates with the genetics. So I tried, whoever I had as patients for iridology, I'm like, okay, if we can do your DNA and we can see more, like exactly which genes and their alleles, because whereas the eye is going to tell us, okay, we know you have this genetic, suboptimalization just from looking at the eyes, because your eyes are your genetic blueprint. But they're not going to tell me exactly, you have FUTAA or FUTGG. They'll give me signs about this, but it's not going to tell me numbers or and letters, and. So it's just fascinating when we know, and then we know, like, okay, so her methylation is poor, but without knowing where, and if there are two G's with between the MTR and the MTRR, not going to know that, okay, we need to give her adenosine cobalamin instead of methylcobalamin. So that's where it really takes it to the next level. And when I see, a DIO2 enzyme and I see the thyroid, and I'm like, okay, well, then it's possible that you're not converting T4 to T3. And if you're taking levothyroxine, which is T4, and you may be taking too much T4 if it's not converting to T3, and maybe later on you can end up with Alzheimer or RA like her mom, and her mom is on a levothyroxine, come to think of it. And we don't know. I did the PGX for her mom, but we didn't do the DNA 360. So that's going to be pretty fascinating because we're going to do that next for her mom to see what goes on there, because the mom has RA and now she's having also like signs of Alzheimer's. And being we're talking about that, if you look at the top of her eye, you'll see like a cloudy, like a milky. Do you guys see that? It's at the very top of the eye, okay? Normally, if I'm going to see that sign, I'll see it in somebody 50 or older, okay? That's when it usually will start. Lately, though, which is really crazy, I'm seeing it more and more in younger people. Now, it can be related to quite a few things, but I don't like to see it in somebody younger than 50, really, because it has to do with lipids that in the blood that start to come through the cornea of the eye. That's not an iris sign, it's a cornea sign. And that will tell me already, okay, well, are you having symptoms of short-term memory, brain fog? And she was, but she thought it's due to something else. And I said, okay. And her mom has it really heavy. Now, we're not born with that. That's something that comes out later, like I said, around 50. Sometimes it can be inherent. That doesn't mean you're going to get it, though, because not every 50 or 60 or even 70-year-old has it. But it's something we don't want to see. When it usually starts up in the head area, we call that a corneal arcus. And like I said, but it's also related to other things. So it could be related for thyroid as well. But that being said, regardless, it has to do with poor circulation up in the head area. So whether it's thyroid, whether it's related for somebody with um, diabetes in the family, because usually people with, and if I see it in younger some person, it's going to be related with that, but it's also cardiovascular risk. Now, if we look back at that eye photo, there was what we call a rarefaction in the kidney reflex area, which was at 6 o'clock. And her mom has high blood pressure and she's overweight already and she's getting fluid retention. So back to those sparkles we were talking about, those also have to do with water balance and fluid retention. So there can be an up and down weight curve going on there. That person is usually, when I see that, I already know there's some mood regulation there. So they can get a little grumpy or like low patience and things like that. It never fails. It also tells me though that they're usually a good caregiver and they have a hard time with disharmony. So they're peacemakers. They don't do well with conflict and they always have a hard time saying no. I've never failed. Anyone with that, they're people uh, are usually those people who want favors are usually drawn to them. That's what I'm trying to say. So like because they're always the one who will say yeah, even though they want to say no. So I always tell those people, you know, I know you have a hard time saying no. So maybe instead of coming right out and saying no, just tell the person, I'd love to help, but let me check my calendar and get back to you. So for those of you out there listening who have a hard time saying no and maybe have those sparkles in your eye and you don't want to make conflict or even then that's maybe a good thing you to do. Just tell people, I'd love to help. I'd love to be there for you. Let me check my calendar and I'll get back to you. Easy peasy.
Yeah, that's fascinating. I'm curious. I'm just trying to wrap my head around some of these concepts because I remember you talking about like the tattoo effect that happens
Yeah.
on the eye, and it's really interesting. So what I'm curious about is the marks that you're seeing showing up on the eyes, like let's say the one relative to the vitamin D pathway. Is that like a cumulative thing? Like with that, you're
Oh,
born
okay.
with genetics. Does it ultimately show up? And if you correct the vitamin D, and let's say you confirm that with a 25 hydroxy panel, so now your vitamin D is good. Does that mark stay the same or does it change? And how do you know that you're moving in the right direction? Like, can you see that with iridology?
Okay, so no, those struck it can they Vanny, can you bring the eye back? And then I show you what I'm talking about because colors can accumulate. So we're not born with certain like okay, so you see how it's very orange and yellow. When
Yeah.
she was little, she didn't have that. That develops. Those things are inherently genetic. Sometimes they come out. Even let's say, like I said, if you've gotten some kind of vaccine, not all vaccines cause that. So let's be clear, if you go get just your regular vaccine, it doesn't always cause that. But the people who were in, I don't remember which war it was, but they were given vaccines of quinine. Well, their eyes turned yellow from the quinine, but that did go away. Okay, but however, this is not from quinine. This is because that yellow marking has to do with kidney function and inherent. So if you look back at the 6 o'clock area, you'll see it's different from the rest of the eye. It's that's what we call a rarefaction. And actually there looks to be a little sparkle in there too. So that tells me then I'm also going to look at that NOS3 gene because nitric oxide synthase. And I'm going to see what's going on there so that we know, whether or not we have to worry about blood pressure, which I'd worry about regardless, especially with all these other markings going on with, the fluid retention and the rarefaction there in the kidney area and the mom who has high blood pressure. So yeah, so back to the vitamin D marking and that little bird beak marking there. Those are, she was born with those. So any structural marking, unless God forbid we had some kind of surgery or accident, injury to the eye, those are there. We're born with those. Okay, that's kind of like your DNA. So when you look at, let's say, the VDR receptor, and that's suboptimal. So you're not transporting or, the vitamin D properly. Okay, that's not going to change, right? You have those alleles, those are there. They're not changing, even though your vitamin D is normal level. Same thing with the eye. So years ago, they used to say, that's why you need to be careful. If you're going to an iridologist, you want to really be careful and look them up, how qualified they are and where they got their certification and that they didn't just do it on a weekend course or something because they used to say that, oh, that's going to go away once you detox or once you get better, those are going to fill in. They don't fill in. What can happen is that pupil will get smaller. So when the pupil gets smaller, kind of like a purse where you pull the strings and let it out and come together, the fiber structure is going to get tighter and longer instead of scrunch up. Okay. So then there may look like it's filled in and it's smaller, but in reality, it's not. It's just that you're going into more parasympathetic state and you're not as stressed. And so the fibers are going to be straighter. So you won't see it as much, but those two are pretty deep. So even though they may look smaller, they're always going to be there. And yeah, and the color, once it's accumulated, it is like a tattoo kind of. Listen, I like to be open-minded. So I'm a big believer in the body healing itself. I'm a big believer in miracles happening. Again, how I like to think that, but I have not yet seen it happen. And those little sparkles, they're not, those were born with too. The sparkles, they can accumulate color. We don't want to see them accumulate color, because when they do accumulate color, then that's signaling to me that there's a toxic burden that's happened. So we definitely want to make sure we're, supporting detox pathways and get ready to help this person detox what needs to be, whether it's heavy metal or mold or whatever it is they need to do. We need to make sure those pathways are open and working before they jump into a detox, especially if those GST family of genes is suboptimal. And that up there in the head area, the milky white, like I said, okay, I've never seen that go away either. And usually it just gets more. So it will start spreading around. You don't want to see that. If I see it early, then I take measures to try to prevent it from getting worse, because that we can do. We can prevent it from getting worse. But usually once it's there, yeah, it's kind of like a tattoo or a reminder. Hey, pay attention, because usually it's also related with cardiovascular stuff and also stubbornness. People starting to get stubborn and set in their ways.
Right. So if you were to use this then as kind of an initial assessment, right, an identification tool, but then also a way of sort of identifying if certain things are getting worse or not, you could then see if that white cloudiness is getting worse and moving in the wrong direction. So you can also use this as kind of a progress tracking tool in a way as well.
Yeah, and more so for the progress tracking, I look at the sclera, the whites of the eyes, because that's more transient, most of those vessels, and it's more dynamic. Those change. So like you said earlier, when we're sick, we may see more blood vessels show up in there. Or when you're crying, that will get more blood vessels. But the sclera will show signs. It will show like a pointing vessel. So let's say we have that little bird beak lacuna there, the round blue circle there. And I already know, okay, this person is genetically predisposed to thyroid issues. And then I have also a pointing vessel. So then showing me over there, I'm going to know, okay, that's been activated. This is telling me, look here, and we're going to definitely do, even if there's no symptoms, I'm going to say, listen, we need to check this, because the sclera will show up. Even the eyes, like I said, those are predisposed. Those are your genetics. Those are there at birth. But the sclera is going to say something's going on. Pay attention. And if I don't pay attention, that's not a good thing. I sent somebody once, I know it will be about a different eye, but there was something there telling me, okay, this person really should go get her breast checked, just to be on the safe side. Unfortunately, the woman waited a little too long. It took her about 5 or 6 months to go. And normally we think, okay, 5, 6 months, not that much. But when I have what we call perifocal signs, signs in the iris and then signs in the sclera telling me, hey, pay attention. And, just to be on the safe side, I'm going to send you to go get a check. And well, she waited. And then when I heard from her next, she sent me a text thanking me. She did go. And unfortunately, though, at that point, it was already breast cancer. Now, I don't diagnose, but if I see something that's going to tell me, hey, go get checked, I'm going to send you go get checked because it's not something to play around with.
Right. So again, relating it to lab work, it's like you can monitor metrics you find in your blood and metrics in your saliva and urine, et cetera. And it's like you can actually also monitor your eye and see what's going
Yep.
on in there and possibly even prevent certain things by getting additional screenings when those red flags show up. So again, it's another thing to keep your eyes on, so to speak. I'm
Yes.
curious if anybody's really commonly on these webinars, you'll hear me talk about this thing about identifying the arsonist. I talk about that a lot relative to immune activation and inflammation and things like that. And in our DNA 360, we've got a bunch of different like areas that we look at as far as how the body's detoxifying, managing inflammation, and bolstering the immune system. I'm curious if there is anything in iridology that can kind of reflect what areas may be failing. Like we have the
Yeah.
GST genes that you mentioned, right? So those important phase 2 detox genes. And then there's things like the lymphatic system that matter. There's things like the oxidative system that matter, the mitochondrial genes, like you mentioned, SOD2, GPX, etc. So do you have kind of ways that you can identify who the arsonist is? Like if it's
Yeah.
in
Oh,
the eye
yeah.
that shows up and
Sorry.
you say, this is mitochondrial or this is more glutathione related, lymphatic drainage, etc.
Sometimes, most of the time, that's what I try to do. So, like with the yellow circles there, those nice little sparkles, that definitely is lymphatic. And that definitely, usually, those people innately know they have a need to move. Those people usually can't sit still very much. Whether it's in their seat or wherever, they have a hard time. They need to move. They know they need to move. So, like, you can tell someone, oh, you should be moving. So you can't do that because it's same thing like with your genetics. If you tell someone, okay, well, you need to take vitamin D, well, I'm already taking vitamin D. Same thing. You cannot diagnose. You have to find out, okay, well, you have suboptimal uh, GC and VDR and CYP2R1 or whatever. So we can't tell them you're low in vitamin D, but we know, okay, we need to make sure that you're always optimized here. And we need to check periodically because, even though they have suboptimal, they may need more than the normal person, but they still have to check to make sure it doesn't go too high and become toxic. And then usually I'm a big believer in formulas, and so to speak. Like I don't like to give isolated unless I know there's a definite major deficiency for one, because if we're giving isolated nutrients, then we throw other things off balance. I like to keep things in balance. So I'm a big believer in testing too.
Test, don't guess, right? That's what we
Exactly.
always say.
Yeah.
So this is interesting. So if let's say someone has their genes done and then they want to take it a step further and use the iridology with you, what does that process look like? Like they have to obviously send you a picture of their eye.
Yeah.
Through our conversations, I know that it has to be very well done. Like you can't have a blurry picture. How does the sessions look? Like they sit down and you kind of hop on just like this and you go over what
Yeah.
is in their eyes?
Yeah, but I'll usually have two eyes. So I always have a right eye and a left eye. This is just for, the webinar presentation to have, just some signs there, but always two eyes. We have a right and a left, and they should tell me different things. So 80% what I see in the left eye comes from the mom's side of the family and 80% in the right eye from the dad's side. Now there's that 20% because of the optic chiasm that crosses over in the brain there from. So anyway, so there's always that little 20% risk. What I'm seeing in the left eye is coming from dad's side. But anyway, so same like with the genes, you get one from your mom and one from your dad, you know. But anyway, so yeah, I'll need clear photos and I need a right eye and a left eye. And then usually I'll ask them what they want my help with first because, I usually some people will come and they're like, what do you see? Just tell me. But, and I can do that too. I can just say, well, these are your predispositions, but I don't say, well, you have this or you have that. But if they're giving me symptoms, then I'll know exactly, okay, let's see where that's stemming from and get to the root cause and then combine it with their genetics. Same thing. You don't go to a doctor and say, here I am, tell me what's wrong with me. The doctor's gonna, how will the doctor know if you don't say, well, my throat is bothering me, I'm tired, I'm not sleeping, I'm not a mind reader. I mean, I can see your genes and, your genetic blueprint, but I can't read your mind. I can tell your story. I can see things, maybe secrets and things, but I try not to be a mind reader. Yeah.
Right. And then if you spent like, let's say, an hour with somebody, how much information are you able to relay to someone in an hour? Like, can you go over quite a few different health metrics in one
Yeah.
session?
Oh, yeah, I do. And I also leave some time, because we have to go over their diet as well. So the eyes usually will tell me also, what type of diet they should be doing. Not like where with the genes they're going to tell you, okay, but yes, I will know certain things. Like there are certain signs even in the sclera that tell me, okay, you're not metabolizing fat properly. Or like this one woman that we just had the eye photo up in her sclera. She had, I think I mentioned that before, what's called protein signs. So I already know maybe she's not eating enough protein, or maybe it's the wrong type of protein for her, or, maybe she's just, I mean, and it shows with the zinc deficiency because you're not getting enough protein, you're going to be deficient in zinc as well, usually, or if you're deficient in zinc, you're not going to have enough vitamin A. So there already, you need protein. Usually, animal protein is where you get your vitamin A from, usually but the retinol form, not the preform. So, but yeah, so the protein sign tells me also then we may need to give you some digestive enzymes as well to help you absorb, your protein or to build up some stomach acid. And like I said, in the sclera, we have signs that are called pingueculus. Now, those are already going to tell me about the liver and fat metabolism. So yeah, you can see a lot.
Yeah, and it all works together, right? If you have someone's genes and then you do a good quality intake, and then you also have the eyes, the picture of the eyes. And then do you ever pair that with like gut mapping? Like we have the gut 360, and that really shows a lot of different
Oh,
things related to the immune
oh my
system.
gosh, yeah. I love that. Yeah, because if you look in the center of the eye, that tells me all about the GI system. So I didn't get into everything in that eye, but in there, there's some what we call, well, I don't like that word, but a lot of people call it crypts. So they're like these little flowers and flower petals inside the zone 1 and 2, which is the stomach and intestines. And so when I see that, I know there's more predisposition for um, diverticulosis. And yeah, there was, and she was having issues as well. So I know that. And then if I look, last time we discussed the FUT2. So there's certain markings that will show me, okay, there's a most likely that there's some issues going on with the intrinsic factor, and maybe you're not absorbing vitamin B12. And so it all kind of goes, yeah, you see everything.
Wow. So even nutrient deficiencies and just improper macronutrient intake. Like your eyes can literally tell you different things about how you should and shouldn't be eating and things that you need to be supplementing with higher than other nutrients. Like you can actually see that in that
Yeah.
snapshot of the eye.
Oh, yeah. And then if we do the gut 360, then, oh, yeah, then it will tell me more like exactly what's the microbial composition. So I'll know, okay, well, if they have autoimmune, I'll see, if there's dysbiosis or leaky gut, because everybody's so wanting to take acromantia, but it's really not for everybody. There are some people actually who have too high acromantia, and too high is not good. As much as people thinking, oh, it's the natural GLP-1, not really. So there's way more than just taking acromantia. Taking acromantia, if your levels are too high, you can do more damage.
Yeah, and Dr. Laura and myself, by the way, while we're on the topic, did a whole webinar about GLP-1s and your genes. So if you guys are interested or considering taking GLP-1s, I recommend checking out that webinar as well because it gives a lot of good information about genes, including the FUT2, glutathione, and kind of how we map out whether or not that's an appropriate consideration for you. And if you're curious as well about the immune system, by the way, Dr. K, I believe, and myself did a really deep dive about immune system genes as well. So that would be a great one to preface this webinar with as well, if you do have the bug to do a little bit more research on how this all works together, right? The genes and the different things that we use to map it out, and the gut, and now iridology, which I'm now a fan of and fascinated by. Um, I know that I have to get my eyes done, and Jessica
Yes.
came a long time ago to do it. I just haven't got around to it, but it's a fascinating topic. Practice. I think that it's very similar to getting like really good quality labs, but a totally different way of viewing it. So, Jessica, I mean, is there anything else before we get into the Q&A that you want to say about iridology, your practice, how you combine it with functional genomics? What do you want the people to know?
Oh my God, I love iridology. It's so much fun and it's so cool. And most people who come to me are so blown away and they're like, oh my gosh, thank you so much. And I can't thank you enough for pointing this out to me and helping me. I mean, just because when you can combine it with other things and people can get to the root cause of where it's stemming from their issues and as well as the emotions. Because like I said, we didn't get into all the emotions. Maybe on another one, we can get more to the emotions behind the certain markings and colors and all that, but yeah, the emotions play a really big deal too, because stress and, emotions trigger a whole effect in that body. So yeah,
Yeah,
but it's fascinating.
yeah, they're so important, and that's why we look at the mood and behavior segment as well.
Mhm.
And emotions are energy in motion, folks. So remember that they play a really big role. I'm ready to dive into these questions if you are, and most of these are, of course, going to be directed at yourself. So if it works for you, I'll read the question, and then you can provide whatever jumps in your head.
Go ahead. Let's do this.
Okay, so Susan has a couple of questions here, and she was asking actually, what do you think of chronic red eyes, which started after COVID years ago and has never truly gotten better? Do you have an opinion on that?
Oh, yeah. Okay. So, well, then you also want to look at those GST genes, right? So, like, because they can play a part. Also, the FUT2 genes can play a part in that because if there's that mucus lining there, with the on the lungs, that can cause more problems and more long-term COVID. People who are more susceptible to long-term COVID issues. And the eyes are just telling me that you still have inflammation going on.
Right, so that it's showing up in the eyes, but it's likely stemming from underlying detox issues and things like that.
Right. So anything red like that in the sclera, that stain is telling me you've got inflammation still going on.
Okay, understood. Susan actually had two questions here. So the second one was about the irises, and she asked, do both irises show the same symptoms or are they different? So the differences in the different eyes.
It depends. Sometimes they'll both. Okay, so this one particular woman, it was really fascinating. Her other eye, the right eye, had the same little beak lacuna, flower, whatever, in the right eye in the same exact position. So like 9 o'clock position.
There you go.
Mm.
Um, so Christy has a question. I'm assuming she's referencing like in your own practice. Do you have a chart or an eye labeled on what part of the eye means what for iridology? Like, do you have any sort of a reference material that you bring to people in your practice?
Oh, I have many charts, but I already been doing it so long that I kind of know where
Right, you can
they
just do it freestyle.
Yeah. But also we're our eyes are not just flat and our bodies are three-dimensional, So some people they may have three kidneys or not, So you can't go exactly pinpoint. You got to know there's a little bit leeway.
Okay, so Nancy has a question as well. It says if someone has had cataract surgery, does it affect how you would read the eyes, or are you still able to determine which genes or blood tests to investigate?
I'm still able as long as there was no damage done to the eye.
Good to know, because a lot of people get those kinds of operations. So knowing that you can still analyze it and get accuracy is a valuable thing.
Well, there are people who have surgery for glaucoma, and they will do laser, and now they do it better. But before there would be like marking in the eye, like black spots, and well, people who aren't educated in that think, oh my God, you have a toxic spot there, because that's what they would say. Oh my gosh, you're toxic, but in reality, it's where they did the laser to remove the pressure from the glaucoma. So that they won't really, well, okay, so that piece is missing, but I'll know it's from glaucoma, but I know it's not toxic. So yeah.
Laura has a kind of a just a practical question here. She says if she were the patient that you just went over with that case study, that she would feel a bit overwhelmed with all of that information. So, if you do see someone or when you see a patient, how do you kind of compile a path forward to help someone just kind of see the path forward? I mean, as far as I get that issue with genes as well, like what do you tell them? What do you not
Overwhelmed.
tell them? How do you simplify? How do you go about that?
Exactly. So I don't usually go over everything in the first session just because it can get overwhelming. And then they go home and they're like, oh my God, I don't remember, it's just too much and whatever. I did that for the webinar just so, people can get an idea or whatever. But normally I'll say, is there something specific you want my help with today? And I'll usually go over that, or I'll point out the three most important things that I see. So that's what I usually do, just like the three most important things, and then we'll go over diet and other things, whatever needs to be gone over.
Right. Yeah. And I do the same things in DNA 360 consultations where it's just like, okay, I can't go over your whole report right now, but I can pinpoint the things that are really the most relevant and pressing, and we can certainly get that done in an hour. So it's one of those situations where you kind of pick and choose what's really most relevant. Um,
Yeah.
Nancy has a question here. I hope I pronounced this whole thing properly. How can one reverse arcus senilis, and that is found on the corneal arcus? Are you familiar with that?
Yeah, Arcus senilis is the new name. Okay, Arcus senilis doesn't sound so nice. So that's like an old term because you don't want to go in here, oh my God, am I senile? They used to call it Arcus senilis because mostly it was seen in elderly people. But it is a corneal arcus. And like I said, once it's there, it usually doesn't go away. I mean, I'm not saying it can. I just never seen it go away or heard of it gone away before. It's kind of like your stamp tattoo. So, yeah, but that doesn't mean that you're going to have the symptoms. You can you can not have symptoms, but just know I've got to always be careful because that's there and I don't want it going all around and getting thick.
Right. Christy has a question that I'm also curious about here. So
Yeah.
she's asking, where did you learn how to read the eye? Like, where did you do all this?
Oh my God, I've done so many. I actually studied with a medical doctor locally. He was thoracic surgeon. I studied with someone in Australia. I studied with someone in Canada. I studied with someone in North Carolina. And I studied with someone, well, that the first one I studied with was teaching the old way. And so I was like, yeah, no, this isn't right. I need to learn this properly. So that's when I moved forward. So I must have studied with, I think I have like, oh, I don't know, five different people maybe.
So it wasn't one sovereign certification. It's like you accumulated knowledge over time and different teachers and different places.
Yeah, because there's same like, well, we have to do CEUs. We have to keep up a certain amount of CEUs in order to keep our certification, our board certification. Otherwise so I just keep learning and learning. There's always something to learn and I can't get enough and I don't want to miss the new stuff. So
All right. And then if you want to be educated on functional genomics, DNA University would be the place to go
exactly.
with our very own
Dance
Dr. Laura.
company, the best. Yeah. And then also the video with the webinar with Lynn on the heavy metals for
Yeah.
those GST. Yeah, that was pretty fascinating.
Yeah. Shout out to Lynn Angel. She's our resident heavy
Yeah,
metal detoxification expert, and she's phenomenal. Okay. So
thank you.
Allison has a question here and says, you were describing long haul COVID symptoms for many of us under 50. We get high cholesterol practically overnight, and we have issues with attention, concentration, and brain fog. We become insulin sensitive or resistant, and we have severe blurry vision, mood issues, etc. Any thoughts on how post-viral issues can affect the eye?
Well, they'll show up as inflammation. I mean, everybody's weak points are different. Same like when you take your DNA, and there'll be some people who are strong with methylation and some no. Some who have optimal SOD and some no. Same with the eyes. You'll see your Achilles weakness, and then you have to go to the root cause of, what may be triggering you having that long haul COVID. So usually I recommend going to the gut because usually that's what's going on there.
Yeah, and there's also genes that are really representative of cholesterol issues, brain fog issues, et cetera. So I think that sometimes with conditions like COVID, it's like they can kind of kick off other negative areas in your genes. And so, like, I would really get a good, robust look at the DNA 360 and just have an understanding of different areas in your physiology that you need to reinforce with high quality interventions. And you never know. Sometimes when you target those things, which are way upstream, the cells downstream can start to behave differently and more efficient. So get the most out of your DNA 360 if you've done it, Allison. Um, she had a
And
two-parter.
the
So
gut
go ahead.
360 too, the gut 360, because a lot of times we have dysbiosis. And when you fix the dysbiosis, that will also help get the other stuff.
Yeah, and so she did have two questions here, but they're sort of the same one. So she has blurry vision after COVID and also has long haul COVID. And she says she also has narrow angles and have had laser iridotomy. Does that affect it whatsoever?
Laser iridotomy. So what was the problem there with her eyes that she did that?
I'm guessing it's the blurry vision. So I guess this would be sort of the same answer as you just provided that if it is long haul COVID relative, it's the inflammation and the
Yeah.
improper detox and stuff like that. Okay, so Jihan has a question, says, hi, what are your thoughts on, I hope I say this right, uveitis?
UVI.
Uveitis? Oh, I was so close.
That's okay.
Caused by,
That's an autoimmune issue of the uvea of the eye. Yeah. So
yeah.
yeah, autoimmune usually from what I've learned, autoimmune basically starts in the gut. There's almost always imbalance in the microbiome also you want to make sure your methylation is supported because methylation is key for inflammation and all that. I always look to methylation and see what's going on with someone's methylation number one.
Yeah, I like it. That's an underlying just cellular process that you have to get right in your body for any amount of gene expression and things to go right. I recommend for that particular topic checking out some of the plethora of webinars we've done just about methylation as well, because that can really help you to get the needle moving with a lot of these different issues. So Debbie's got a great question here. How much can iridology help with diagnosing gut issues? Colonoscopies say everything is fine, but I have severe gut dysbiosis, and my natural health practitioners have not been able to help. And she has a lot of food sensitivities and trouble with fiber and probiotics, but still have issues, bloating, nausea, diarrhea, etc.
Yeah, okay. So with iridology, we can see, well, I have to look at the area what we call zone 1 and zone 2, which would be this GI area in the eyes to see whether it's constricted, enlarged, what the fiber structure is there, what the colors are in there. There's a lot to it. It's not just like one little, answer, but I'd have to see that. And then also, I recommend also the gut 360 for sure, because if you want to see what that fusobacteria is. If it's too high, you want to see whether there's any mycoplasma like tenor cuties. You want to see what's going on with that proteobacteria and the actinobacteria ratios. There's so much.
Yeah, I'm a big fan of the gut mapping and doing it. The genes you've only got to do the one time, right? But the gut is such a dynamic environment that doing
Yeah.
food sensitivity screenings and doing gut mapping, those kinds of things can be done like on a yearly basis just to make sure that you're kind of keeping track of it. Um, Jihan
Yeah,
has another question. Go ahead. Sorry.
there's also blood tests they can do to check for lipopolysaccharides endotoxemia, like the CD14. Yeah, to see what's going on with that, if any kind of inflammation, and the SIG-A.
Yeah, I'm a big fan of SIG-A as a marker. I think that it really gets you a window into immune activation in the gut. So definitely, I'm in agreement on that one.
Actually, the tears of the eyes, there's SIG-A in the tears of the eyes also.
There you go. So if you don't like doing blood draws and stuff, by all means, use your eyes. Um, so Jihan has a second question here saying also, can cataracts be reversed? And what are your thoughts on the eye drops that are said to reverse it? Is that a thing or is that
Yeah, I
like
think there's something called Can-C, and it's a natural eye drops. Some people say they work. Yeah, I mean, I personally haven't used them, but if the cataracts are in their early stage, then yeah, they can be. If you do the right work, yeah. But if they're way, way heavy already, depends on the severity of the cataract.
right? So maybe using the drops in combination with all of the other health strategies and things that would help you to kind of moderate that.
Yeah.
Um, DP was just asking, does it matter if it's left or right? I believe you already answered that, that when you do a consult, you do both
Do
eyes.
both.
Oh,
Always both.
always both.
Always both. Yeah.
Okay, so what about floaters? And like, what are floaters, and what do they tell you if you see floaters? Is there anything relative to that in your practice?
I don't see floaters, but I mean, I can't see your floaters. You see your floaters. It has to do with the vitreous humor in the eye. So, like, there's a gel-like substance, and sometimes if it's not fluid, you can see those floaters.
Okay. Um, Ruth has a question and is actually asking, how can we find someone in their own local area that does this kind of eye analysis, and what profession is this? Like, what's the actual term for your profession with that?
Iridology, iridologist.
Right.
But you want to find somebody qualified, or you can send me the photos through the DNA company, get in touch with the DNA company, and we'll get you set up. We just need some really good photos. It's actually works pretty amazing. I have a lot of clients that are virtual all over the world, actually. So yeah, it works. We have Zoom these days, and we have so much technology. Yeah. But if you do want local, you just want to really make sure they're qualified and not someone who did a weekend course.
Yeah, absolutely. So, I mean, virtual meetings are pretty much going to give you the same amount of value as in-person meetings when it comes to this. So I recommend that you email CEO at the DNAcompany.com. You can ask for Jessica and her services and be set up properly because all of this can be done over Zoom. And so that's the beauty of 2026 and where we're at in
Yeah,
healthcare.
right.
That's one of the
I
good
love
things.
virtual ones actually because I
Yeah.
have them already there big on my screen to look at.
Yeah. So Joanna has a question and says, I'm curious about the sclera and the veins on it. Does the shape of them can be an indication of specific issues? She
Yes.
notices very squiggly veins that come and go.
The very squiggly, we call them blood vessels, the very squiggly ones are very common. Those are most common. We call them meander vessels. And when they're really thick and heavy, usually those people are more prone for hemorrhoids and varicose veins, things like that. And when they're lighter, they're more of like spider veins. Oh, and sometimes they're genetic too. So maybe your mom has that, spider veins or varicose veins or hemorrhoids. Those are the most common.
Gotcha. Okay, so then Rhonda has a question here. What causes nodular or Salzman's nodular degeneration? Can DNA
Oh,
predict, and is there a deficiency? Do you have any thoughts on that?
I've seen that once. I did have someone once with that, and it looked like a really thick corneal arcus, actually. And the symptoms, okay, so I kind of evaluated it as a really intense corneal arcus because that's what it looked like. And sure enough, it was exactly the same uh, biomarkers and symptoms.
Interesting.
Yeah, I've only seen that once actually.
Yeah, so it's definitely on the rare end then, but
Yeah.
still happens. Um, let's see. Susan has a two-part question here, and she's actually asking about the photo itself. So she says, "How do you take a clear photo of the eyes to do a session? And is there a specific resolution that you need to use to get a really good shot that you need?"
It depends. Is she using a cell phone? A lot of people, I have a client coming up on Monday, and the photos she sent me are amazing, like professional quality. And she actually did it with a cell phone.
Hmm.
So, what I find is even those Samsungs take amazing photos. I don't know what kind of phone Susan has, but you can definitely take it. What you want to do is enlarge your screen. You take your fingers and enlarge like to the enough that it doesn't get blurry. Because sometimes when you enlarge, it can get a little out of focus, and you want to get as close as you can and snap it. And if you can put it on a stand, a tripod or whatever, or lean, have somebody take your photos and lean the elbows on the table so that it doesn't get shaky. It's always best to have somebody take it, but I've had people take their own and I was blown away like, wow, you did that. And one person was with an iPhone 8. I find the older phones are even better actually.
There you go. Um, okay, so Elizabeth has a question. Is there a common reason for waking up with a bloodshot eye and in the absence of any external trauma?
Oh, it could be either maybe you're irritating your eye in the night, or maybe you have some kind of infection going on. It's possible there's a low underlying infection that's causing that. I would get it checked out. Yeah.
Can trauma cause that if like you had previous trauma to the eye and then there's kind of a recurring situation where it gets red and goes away? Is that possible?
Uh, it's possible. Usually, sometimes they call it just a spontaneous bleed. Sometimes maybe if you're getting sick or if maybe, pressure, or sometimes people get it from a sneeze. If it goes away, it's usually nothing to worry about. But if it keeps coming back, I would just get it checked to be sure.
Yeah, it makes sense because like I actually had shingles happen like in my eye years ago, and it's the now and then just the right eye, which is where I had the shingles in. it will get just beat red out of nowhere and nothing takes it away for like a couple of days and then it goes back. So I'm like, what is the lingering effect of that? Like, was there damage to the eye? Maybe I should just send you some pictures and see what you can do with your
Send
iridology
me
on me.
pictures, but email me. I'll send you a form email.
All right, sounds good. Okay, and that was our last question. So great job on those, Jessica. I hope everybody learned a thing or two tonight about iridology. I know that I did, and I'm not sure if we'll be doing a part three to this, but if we do, then perhaps I'll make sure to send you my eyes prior to it. So thank you everybody for showing up. I hope you guys learned
Thank
some
you,
stuff.
everyone.
Yeah, Jessica, do you have any kind of closing
Justin.
thoughts for the audience tonight?
Well, thank you for showing up and feel free to reach out to DNA Company if there's anything, you'd like to know more about your eyes. And thank you all.
Thank you, thank you. Thanks for showing up, everybody, and we will see you on the next one. Jessica, this was lovely. Thank you so much.
Thanks, Justin. Good night, everyone.
Good night, everybody.